aflibercept, bevacizumab, and ranibizumab for diabetic edema. Definition is an accumulation of fluid in the macula, part of the retina that controls the most detailed vision abilities due to the leaking blood vessels. In order to develop DME, you must first have diabetic retinopathy. Diabetic macular edema. The relative efficacy and safety of intravitreal aflibercept, bevacizumab, and ranibizumab in the treatment of diabetic macular edema are unknown. Method: and 89 clinical sites were randomly assigned 660 adults, men aged 61 to 10 years, plus with a diabetic macular edema involving the macular center to receive intravitreal aflibercept at a dose of 2.0 milligrams to 224 participants. Bevacizumab at a dose of 1.25 milligrams at 218 participants, and bevacizumab at a dose of 0.3 milligrams to the rest of the participants. The results from the baseline to 1 year, the mean visual acuity letter score ranged to 0 to 100, with higher scores indicating better visual acuity. A score of 85 is approximately 20 to 20, improved by the 13.3 with aflibercept, by 9.7 with bevacizumab, and by 11.2 with ranibizumab. Although the improvement was great with aflibercept than with the other two drugs of bevacizumab and ranibizumab, it was not clinically meaningful because the difference was driven by the eyes with worse visual acuity at the baseline. When initial letter scores was less than 69, the mean improvement was 18.9 with aflibercept, 11.8 with bevacizumab, and 14.2 with ranibizumab. The conclusion: intravitreal aflibercept, bevacizumab, or ranibizumab improve vision in eyes with center-involved diabetic macular edema, but the relative effect depends on the baseline visual acuity. When initial visual loss was mild, there were no apparent differences on average among study groups.
Welcome to the Science of DME, presented by the Angiogenesis Foundation. This animation describes the development of diabetic macular edema and empowers you, as a diabetes patient, to manage your condition. Diabetic macular edema, or DME, develops as a complication of diabetes and is a leading cause of vision loss among working adults. Anyone with type 1 or type 2 diabetes is at risk. Diabetes occurs when the pancreas, a gland between your stomach and your spine, fails to produce adequate levels of insulin or is unable to use the insulin properly. This harms the body's natural ability to control blood glucose levels, which become dangerously high without consistent management. High levels in blood glucose can lead to a number of conditions, including vision-threatening diseases such as diabetic retinopathy and DME. DME can occur at any point in the progression of diabetic retinopathy, so the presence of both conditions must be monitored to prevent vision loss. DME involves the retina, the tissue at the back of the eye that receives and processes what you see. and the macula, which is a small part of the retina critical for seeing clearly. DME occurs when blood vessels leak fluid into the retina and macula, causing edema. Why does this happen? Retinal blood vessels become weak or blocked when blood glucose levels are too high, such as in diabetes patients. The retina cannot receive enough blood or oxygen and sends signals to surrounding tissue for nourishment. VEGF is then released at abnormally high levels. Too much VEGF weakens the vessel wall and makes it more penetrable, so blood vessels become leaky. As the vessels leak fluid and blood into the retina and ultimately the macula swells and thickens. This is the condition known as macular edema.